how exactly a brain of a co-founder or a CEO works. Like you start a company, you face a problem which is very personal. You
Yeah.
make business out of it as well, right? And you do something which actually is very helpful for society as well.
Marketing in healthcare is very different, right? You can't just go and tell them, okay, this is the offer, you join now, right? So you need to continuously keep providing value for earning their trust.
So before we start off, I would like to know, for me as a third person, if I see at Fitterfly, I probably want to see based on whatever is available on digital website or anything like that. I can see that it's a website where it's a place or it's an organization where who helps me basically in terms of consulting if I have diabetes or if I'm suffering from obesity or something like that. What exactly is Fitterfly? Like, if you want to add something on this.
Yeah. It's not just about consulting, it's about basically working with people to reduce their blood sugar, to reduce their weight, to deliver outcomes, right? And we do this with a mix of, experts and technology.
So,
Because
how exactly does this work?
yeah. So basically what happens is if you see usually if you have people with diabetes in your house, you know, uh, normally they take just medicines, they go to the doctor once in a quarter, they do some blood tests and that is it.
True.
ज्यादा से
My
ज्यादा
mom
the
is
doctor
actually
will,
diabetic, so I know.
yeah,
Yeah.
ज्यादा से ज्यादा the doctor will say चीनी मत खाओ और walk करो बस.
Yeah.
But that is not enough for diabetes. Okay.
True.
So basically, the medicines just fix the symptoms, which is the high blood sugar. But what is actually causing that high blood sugar, they don't fix, right?
Okay.
So what we do is we work on the core of the problem, right? We fix the lifestyle factors. Basically, the weight, right? The obesity and weight is actually one of the biggest causes of diabetes, type 2 diabetes, right? So
Okay.
we work on that. We work on reducing the weight with a combination of nutrition, fitness, stress management, and sleep management. And on top of that, we help them build healthy habits for life because it is not just about, there are a lot of programs in the market where they will just reduce your calories for 3 months and you get it,
Yeah.
you manage your diabetes and then again you go back to your normal lifestyle and then again it goes back, right? So that's not what we do. We, along with all of this, we also help them with habit coaching, right? So that
Okay.
they pick healthy habits and they're able to maintain it for life. So that's what.
So, so, doctor, what I'm able to understand from what you're saying, rather than giving them a diet plan or something like which usually is done by dietitians or probably gym trainers or those people, what you guys do is you try to build an habit. Because from what I also have heard, that diet you can follow for a month or two,
Yeah.
but it's a lifestyle which you will follow for a long period of time, and eventually it will keep you healthy. I believe this is the thought process behind it, right?
Yeah, we give a diet plan, but we see we have gone beyond those usual diet plans. Usually, when you go to a
Okay.
nutritionist, what happens is they'll ask you, what is your normal food style like? What do you like
Mhm.
eating and all of that? And they'll make you a diet plan according to the calorific values that you need to attain, right? But here we use technology. Okay, we have something which is, we have an IP, which is basically, it's called PGR. Okay, personalized glycemic response. So what happens is, this is a recent finding that, you know, what I eat, what you eat, it produces different kind of responses,
Oh,
right? As in, if I eat a laddu and if you eat the same laddu, right, your blood sugar rise may be lesser than mine.
okay.
Okay, because my body is different, your body is different, right? So if you make a normal diet plan, it won't work for everybody, right? So you need to figure out what exactly works for this person and then, figure it out, right? So what we've done is there is something called a CGM sensor. So we attach it to their arm for 14 days. So it's like a blood sugar movie. Okay,
Okay.
so it gives you continuous blood sugar reading for 14 days.
Okay.
Okay. So it measures your blood sugar every 15 minutes. So it's like a continuous monitor. And what we have done is we ask people to log their meals during those times, 14 days.
Okay.
So we know exactly how your blood sugar is responding to everything you eat. Not only everything you eat, but the portion that you eat, how much you eat, and also the timing that you eat. How does it interact with what medicines you take? How does your activity, like if you go for a walk, you'll see your blood sugar going down, right?
Hmm.
So all of that, right? We see what works for you. For some people, yoga might work. For some people, something else might work. So we make a very customized plan according to what actually works for you, rather than, just making a one size fits all plan. And that's the
So I
secret of
believe.
our outcomes.
Okay. So, from what I'm able to understand, you're doing something similar to what usually matlab, I used to do, but I used to do in terms of data. I used to study data, and based on that, we used to understand the user behavior on the website and other platforms. So, you're doing similar in health department, I believe.
Yes.
You're understanding the pattern or how exactly the blood sugar level is reacting to what he's eating, and then probably based on that, you're recommending something,
Yeah.
right?
It's like the basically the body is trying to tell you. Body knows what is good for it, right?
Okay.
Trying to tell you. You just need to listen to it with the help of this technology,
Okay.
making
So,
it in very simple words.
So, if like we will come to the perspective of knowing Fitterfly as a brand, but before that, we are talking more about nutrition as such right now because that's what the base is, right, for this particular brand Fitterfly. So, I wanted to know what exactly do you think are, I would say, the big mistakes or I would say the wrong decisions which people make, like at a global level, you might have experienced, or even if you talk about our country, national level as well, because of which the probability of people ending up getting being a diabetic patient increases. Any particular few reasons you might have jotted down, or as a team you might have come up क्योंकि data बता रहा है कि this is the major reason इसके वजह से ये हो रहा है.
In terms of nutrition, you're asking, or generally
Both
lifestyle?
you can like lifestyle as well as nutrition.
I think nutrition wise, I think again, again, it's very cultural, right? Like the ratios are very high in our country, right?
Hmm.
And we also have a genetic predilection, right? We are more prone to diabetes, anyways, because of our genetics, right?
How is that?
There are certain genes which are there.
Okay,
Um,
because of this
I don't want to
behavior.
comment on the exact gene name and all. I'm not qualified to do that, but
Yeah.
generally, I'm saying that we are more prone to this. Our insulin
Okay.
resistance is high, right?
Okay.
So, and we develop for whatever little bit of weight that we put on. Like you see in India, a lot of people who are not very overweight also have diabetes, right?
Yeah, true.
Because of the genetics and because the insulin resistance, right? So insulin resistance means that insulin doesn't work properly for those people. Okay, so there are certain so basically what happens when you eat, right? Insulin acts like a key which will allow whatever you eat, the glucose to get into the cells. Okay,
True.
and that's how we are able to utilize it for our work or whatever, right?
ATV molecules, yeah.
Yeah.
बचपन में
But
पढ़ा था.
but what happens is when there is resistance, it's like the lock and key mechanism. अभी वो lock का वो change हो गया है. अभी key काम नहीं कर रहा है. It's like
Okay.
that. So basically, the glucose doesn't get into the cells for its intended purpose, which is to give you energy to do work. But it goes into the bloodstream. That's where your blood sugar rises, and you don't have enough energy. Okay, so you feel you're hungry, right?
Okay.
So you eat more. So if you see, especially in the first few months when you're diagnosed with diabetes, you'll have a lot of hunger, right? I mean, how much ever you eat, you feel hungry, but you're feeling again low on energy,
Hmm.
right? That's because of this insulin resistance. So I think one of the biggest mistakes that people make is having a high carb diet, right? And in India, we have seen protein again, like you said, is less. Fiber is very less, right? Fiber used to be high in our ancestors, food because they used to
Yeah.
have a lot of like vegetables and all of that, right? And very fresh vegetables, right? But these days we have add a lot more gravies than vegetables, right? And even the kind of cooking and all that has changed quite a lot. We overcook stuff, right? That's also there. I think the more we go back to our roots, the way our ancestors used to eat, right, the better it is. Second is, I think everybody nowadays, they don't consciously eat, right? I mean, most of us, like even I am guilty of it sometimes because I also don't get time to watch TV much. So sometimes what happens is, while I know all this, I consciously try to eat separately on the table. बट कभी कभी ऐसा हो जाता है कि कुछ इंटरेस्टिंग था नेटफ्लिक्स पे आई वांट टू कंटिन्यू इट आई गॉट 10 minutes during lunch so I'll just have lunch watching TV, right? So you don't consciously eat, so what happens is that you tend to overeat, right?
Yeah.
Or your body also likes it better when you consciously eat, right? And it digests better. So all of those kind of mistakes also people make. And not drinking enough water. Again, water is also very important for reducing your fat, right?
Mm.
So that also people don't drink enough. And what happens these days, like even my own kid, like my own daughter, she prefers having other forms of water, like juice or something like that. She will not have water per se, right? So sometimes it happens, like, so that mistake also people make. Then again, exercise. Again, like people think that walking is enough. Okay. That is one of the biggest myths that people have, that walking kar raha hu na bas. But walking is just cardio, and that too, it is not giving you enough exercise, right? It is good, but it's not enough. So you need strength training as well, whether you do like some kind of body weight exercises, or you do it in the gym, or you do it at home with some dumbbells, whatever it is. But that's very important again. So it sort of, with strength training, you're turning your body into sugar burning machine, right? So
Yeah.
that's what it is. Then cardio also, you should get enough amount of cardio. Your heart rate should go to that particular level, to make sure you're burning sugar, right? All these things. So when you have an expert guiding you, it becomes a lot better. And what we do at Fitterfly is also we do some assessments to figure out where you are in terms of your stamina, in terms of your upper body strength, lower body strength, and all of that. And then we give the plan. Okay. So it's very personalized as per your needs. So that's why it works. Right. Coming to the other mistakes, again, sleeping late, like I told you, not getting enough sleep. And it's not just about the number of hours of sleep, it's the quality of sleep as well. Right. So, sleeping, getting some time off from screens, like maybe 1 hour before sleeping. Most of us are guilty of, like scrolling while sleeping also, right?
True.
We want that only to make us fall asleep.
Mm.
But that is a bad way to fall asleep because you don't get enough REM sleep, right? That restful
What is
sleep,
that? Ah,
rapid eye movement sleep, that's when your body is
okay.
in its most restful state, right?
Okay.
Like if you get enough of that, that's more than enough. Like you don't need 7, 8 hours of sleep, but you need enough REM sleep, right? So that's
I have heard that.
yeah. Yeah.
Yeah.
So that you don't get properly if you're one is your mind is, like if you're working till late night, right, and you immediately try to fall asleep, or you're watching Netflix or something and you're trying to fall asleep, so your REM sleep gets affected, right? And
Mm.
that's why you don't feel fresh in the morning, right?
Mm.
Then late night snacks. Again, this I've heard a lot
Yeah,
of this.
that's actually a big problem.
Yeah, because if you're sleeping late, obviously, if your dinner is little early and it's mostly carb, then you will feel hungry in the night. And when you feel
Mm.
hungry in the night, you don't know what to eat, right? Because like your meals are done, like mostly stuff has gotten over at home. So then you tend to eat anything which you find. Maybe it's biscuits, maybe it's, I don't know, snacks, right? Which is unhealthy again. So, but there are healthy snacks also you can have just before sleeping, right? Like you can have a glass of milk or some nuts or something like that, which can keep you full as at the same time it's healthy, right? So all these kinds of mistakes I've seen people doing. And last thing is stress. I think it's not a mistake, but it is something that people are very prone to these days, right? Like whether at work or at home, they're living stressful lives. So I think not working on their stress levels actively, right? Not paying heed to what is causing you stress is also a very important mistake, I would say that way. Not giving yourself some me time, not enough self care, not loving yourself enough to stand up for yourself. All of these things are also causing stress, and hence again increasing your blood sugar.
So, in a way, we can say that Fitternet is trying to help everyone build that mind, body, and soul kind of a thing, where
Yeah.
everything is like been taken care of. Eventually, by if you eat right, you will feel right, you will stay happy. Everything gets, I think, sorted in terms of once you start eating right thing, once you have a healthy
Yeah.
like body to yourself. Fine.
Not
Now
just
coming to the org part, organizational part, I wanted to know, like from what I'm able to understand, that Flitterfly started in 2016, right? So I wanted to know what was the thought process, if you're aware of, key, what problem statement. Obviously, these were the problem statements, but how this idea came or how exactly it started.
so actually it didn't start as a company dealing with diabetes. It started as a children's fitness company. Okay.
Okay.
So I was not associated with them at that time, but Dr. Arbinder and Shailesh and there's another co-founder at that time. So all three of
Yeah.
them were working on children's fitness solutions, which included some offline center as well. And they're tying up with schools and trying to come up with some programs for children to keep them fit, because they felt that if India starts coaching them at that age, then obviously tomorrow will be much healthier, right? So that was the whole thought process. But since schools are involved, and like it's a very complex space again, like they're not able to take decisions for themselves, and because there are schools involved in between. So I think that's where, at the same time, what they started doing is they were building this nutrition database. Okay.
Mm.
Because for catering to any kind of plans and all that, you need like a nutrition database. Okay, either you can get it from the market, or you build one on your own. They felt
True.
like building one on their own because what is available in the market is not very Indian in nature. I mean, there are not many
True.
good
True.
Indian databases, right? The local databases. So start building that, and that became a very big, um, star product, right? So, and they started working with Nestle, Danone, and other such companies where we are supplying the nutrition database to them, right? In many languages and in many basically all localized foods as well, you know. So that happened, and then when this was going well, Dr. Arbinder Singhal got diagnosed with pre-diabetes. Okay.
Okay.
And he has diabetes in his family. He has lot of heart disease in his family and all of that. And that's when these CGM sensors also were there in the market. That just come out in the market. As in India, it was just gaining popularity. So he
Okay.
wanted to try out himself and see what happens. Okay, he was very,
Okay.
even though he's very active, very fit, even then he got pre-diabetes, right? So, and pre-diabetes is like a warning sign. It's like your
Okay.
body giving you a notification saying that अरे अभी कुछ कर लो नहीं तो diabetes हो जाएगा,
Yeah.
So so what he did was he tried that CGM sensor, and he started noticing how his body is reacting to what he eats and all of that. And then he could actually reverse his pre-diabetes with that. So
Okay.
in I think in 2-3 months he could reverse his pre-diabetes, and that gave him the idea that if it can work for me, why can't it work for others, right? So that's when he
So
started working on it, on the whole program, and he worked with the other two co-founders, and he started setting up the programs and all of that, and that's how it came into picture.
I think, see, I understood what you said, but there is one small and beautiful thing which you are able to, which anyone can probably point out, that how exactly a brain of a co-founder or a CEO works. Like you start a company, you face a problem which is very personal. You
Yeah,
make business out of it as well, right?
yeah,
And you do something which actually is very helpful for society as well.
yeah,
So I believe that small so I know it's incorrect to say this, but that small part where he had a diabetes was actually helpful for the whole country. That
Yeah,
because of which many
yeah.
people are able to,
So
yeah,
I believe in this. Everything is a blessing in disguise. If it's not a
yeah.
direct blessing, it's a blessing in disguise. अब कुछ तो है उसमें.
I just wanted to know. I know, like you being expert into this. I wanted to know what are these pre-diabetic signs, because at a very normal level, what are the things which मतलब a normal man can notice? Okay, this might be a sign, because
Hmm.
वो चीजें अगर हम we can prevent it right there and people start noticing it, then eventually जो आगे जाके problem आती है, the problem which they face eventually probably when they go to the higher level, where it starts affecting their eyes and like I don't know, hearts and everything. So that can be kind of eliminated. So what are these signs which we are talking about?
You're talking about signs in pre-diabetes or diabetes?
Pre-diabetes.
Okay. Pre-diabetes, usually there are no symptoms as such, but what we would say is that everybody about the age of 35 should get themselves tested at least once a year for HbA1c, right? Because
Okay.
HbA1c is the is the golden test which is recommended for diagnosing diabetes. So we recommend that everybody test themselves after 35. Because earlier it used to be like 45, but now the age of this incidence is decreasing day by day. So 35 also should be good, especially if you have a family history. तब तो पक्का करना चाहिए, है ना? And there may not be many symptoms as such, like not those actual diabetes symptoms, but you will see that you'll find it difficult to lose weight, right? Or you feel a little more hungrier, right? Or you feel a little tired because your blood sugar is, I mean, your glucose is not being utilized properly by your body, right?
True.
Some of these symptoms, and in women, there are these PCOS and other hormonal issues which get started, right? So that's also, one of the, ways it shows up, right?
Okay. So I got an gist of it, what you're saying. Now I wanted to jump on a factor of a little bit of marketing. Now knowing that Fitterfly and yeah, you are doing a noble work where you are helping people get rid of diabetes or probably consulting them and helping them and providing them support what is required. How difficult was it for Fitterfly, or what were the challenges which you guys faced in terms of making people aware that okay, this exists and you should consult it or you should use us? Because from what I'm able to understand, even today, me myself, when I go and talk to my mom, कि मम्मी ये मत खाओ, ये मीठा है, ये ऐसा है, वो वैसा है. It's a challenge for me. Being
Hmm.
like having that rapport with my mom itself, it's very difficult to convince her कि ये मत करो या ये blood test करवा. So, what was the idea, or what were the challenges, and how did you overcome those challenges as a Fitterfly, as an organization, to spread that awareness and eventually like make it what it is?
So, I have been dealing with people with diabetes for a long time now, right? It's a personal passion as well. It's like I've taken it upon me as a personal challenge that I want to solve for this problem, right? So, even before Fitterfly, I worked with another company which was in the diabetes space. And even between both of the jobs, I had my own consultancy where I again worked with people with diabetes and I published a research paper as well. So very passionate about the space. And what I've seen is that there's a lot of inertia in people with diabetes because it does not show up. If you take medicines, right, what is happening is the symptoms are controlled, right? So there is no pain. So where do you take maximum effort, right? Where there is some kind of pain or it is affecting some organ, or if it is, like you have to go in for some surgery, or it's affecting you in terms of your spends or your insurance premium, something like that, right? That's where you take some action. If nothing is happening, because diabetes is slow, okay, it doesn't
Slow
progress
poison.
immediately, right? So they don't do anything about it, but diabetes is nicely sitting inside and it's doing its work, right? And it takes a long time for it to show symptoms, like proper symptoms, and it takes even more time to affect your organs and all. So what happens is people take it slow and cool. They're like, okay, I don't need to do anything right now. I'm taking medicines and I'm doing everything the doctor is saying, so it's okay, right? And what happens typically is that थोड़ा increase होता है हर बार, doctor will increase the medicine. Okay. So, but what I've noticed is that there are triggers, okay, in a patient's journey. Triggers could be anything like if suddenly they have a lot of symptoms, okay, they are feeling very, very tired, they're not able to work, or they might be, something like they are feeling they need to go to the washroom quite a lot. That's a very irritating thing, right? So again, or they may have some sexual dysfunction, especially in males, they're very conscious about it. Or if their medicines are increasing quite a lot and the doctor tells them you need to do something and I to insulin de dunga. Okay. So, or if they've been asked to take insulin, or say a woman, she wants to get pregnant, right? And she's not able to get pregnant because of her diabetes. So all of these kinds of triggers, या फिर उनको एक surgery कराना है, but doctor is saying you control your blood sugar only, then we'll do the surgery. So all these are triggers, right? तो ये trigger point पे उन वो decision लेते हैं usually. Or if a caregiver is sort of pushing them, like, you may be pushing them, for example, right? You may be pushing your mom, okay, do it, right? And she may do it for your sake, right?
Yeah.
Or a spouse may be pushing the other spouse, ki, kar lo. Yeah, फिर the daughter, son, whatever, right? Or parents might be pushing the kid, whatever. So all of that happens. So the trick is that you stay. There's a lot of value you as a brand can add in a person's life with diabetes, because there are so many questions they have, right? That's where value-based content marketing plays a very strong role, right? Whether it's your blog, whether it is having a community, whether it is having webinars, whether it is having your social media presence, okay? All of that matters a lot, right? So you build a brand with them, a genuine, authentic brand, which is there to help you. Don't keep pushing the program all the time, right? So, but when they need it, and they will need it, they will come to you. Marketing in healthcare is very different, right? You can't just go and tell them, okay, this is the offer, you join now, right? So you need to continuously keep providing value for earning that trust, right? And that you can do very well with content marketing, where expert driven blogs. Then you have your community where they can come and ask questions. On social media, you reach them through webinars and interactive sessions. You educate them. You be there when you need them, when they need you, right? You be there when they need you, and then so that you build that brand in their mind, that this is the brand I trust for diabetes management, right? So when the trigger happens in their life, whatever that is, whatever I told you, then they trust this brand, then they come to us and they say, acha abhi batao aapka program kya hai, you know so that's the strategy that we follow, right? And that's working for us, and it's taking some time. Obviously it takes time to build a huge brand with minimal budgets, but we are doing it consistently, and that's helping us.
So, from what I'm able to understand currently, content marketing which you guys are doing, apart from that, majority of the users of Fitterfly uh, come to you because of the way they have heard a review from someone else, right?
Yeah.
It's basically mouth publicity which works over here, I believe.
Yeah,
Right.
a word of mouth publicity helps, but we also do paid marketing, in the sense that when people are searching for diabetes management programs on Google, or they are surfing on Facebook and they are clicking on other diabetes management programs or thing like that, we have to be there, right? That's a part of paid marketing that we do. And
Performance marketing.
apart from that, we have referral marketing, which is from our existing customers. When they have good results, they do refer us to their friends and family and all, whoever needs us. Then we have partnerships, right? We partner with doctors, we partner with corporates, we partner with other companies like medical device companies and all of that. So, that's where our, next round of customers come in. So that's how it works.
I think a major chunk can be targeted considering the corporate area. corporate way of marketing, where because knowing that majority of the people who are suffering from this problem are the ones who actually sit at the desk, right?
Yeah.
And at an org level, if like I'm like being co-founder, I have like a team of good 20 30 people. So if there's something goes wrong with my people, and let's say one of them get diagnosed with diabetes, or eventually I would want ki सबका ही health should be taken care of, should be audited at least, so that
Yeah.
everyone is healthy. And yeah, so I guess that is a very good action in terms of marketing and building a bigger brand. Apart from this, I wanted to know, Reshma ji, how was your experience in Fitterfly in terms of not the work culture, I would say, but more of you have an experience previous as well into healthcare sector. And if you compare that with Fitterfly, what is the difference which you notice in terms of adding that value to the society or something like that? What
Yeah.
are these things if you would like to highlight?
I think Fitterfly, everybody is aligned to one purpose, which is outcomes, right? And the kind of the team which we have, even at the management level and all that, it's a very good mix. It's not just engineers trying to do healthcare, but it's actually doctors, it's actually, nutritionists, physiotherapists, psychologists, like even people in marketing are from healthcare, like you can imagine that, right? So
Yeah.
we are all very core healthcare focused brand, I mean, team, right? And even in our teams, we have a lot of people from a healthcare background. So that makes a lot of difference because I think, the knowledge and, the focus helps, right? And apart from that, like we have good technologists also, right? Who can
Mm.
work with us very closely to, build what we want to build. And the
Mm.
third, I would say, is the culture. I think it's never give up is our culture, right? So we never give up
Mm.
on anybody. We never give up on any challenge. We always, we do everything like the kind of stories that if you want to hear sometime else, the kind of stories that are there where people have gone much beyond their call of duty to help our customers to get outcomes and all of that. So that's amazing. Like if you go to our Google reviews and see, you will see all our great reviews about the coaches, how they've helped them, even when they were not supposed to help. So all of that. I think that those 3 points I would say, the outcome focus is huge. And that's what I love about it because there is no politics and all of that. Like you do your work, you get outcomes, that's it, right? Like you don't, and it's very patient centric, very customer centric. Yeah.
I'm a little curious to know those pointers which you were saying, where a small story, if any small, if you would like to have that on a
Yeah.
podcast, where what instance exactly took place where you did something where it was beyond
Yeah.
like a normal
Sure.
procedure. Anything you would
So,
like to add?
yeah, so one of the customers had taken a program from us and he was flying to the US or somewhere, like he was flying. And he said, I'm leaving for the US in the morning, like a some 8 o'clock flight or something. And I need the CGM sensor applied, right?
Mm.
So it needs to be delivered to my house and all of that. And night he told us. Okay.
Mm.
So the team actually came to the office around 5 o'clock. They took the sensor and they went and applied it. And he was so happy, And it was a big teamwork, right? Like office needs to be opened. The person needs to get
Yeah,
up
yeah.
there, get it, go and put it up there. And it was not like a logistics company or something. Our own salesperson went there and he put it up for this guy. So that was one. And then there was this photo that like I still remember one of our salespeople, like one of our call center guys. So he was basically one of the customers called him when he was on the bike. Okay,
Okay.
he stopped the bike, he parked the bike, फुटपाथ पे बैठ के लैपटॉप ओपन करके he's telling about the program. And the guy who was sitting with him actually took a picture and he shared it with us. Like, okay, this is what it is, right? This is the kind of passion, you know. It's like, it was already late night, so he didn't want to further delay it. And that customer wanted to close it that day. So that's why
Mm.
he did all that, right? And then there are coaches who, you know, Like actually, when there are certain people who are going to certain restaurants, right? Like the customers are
Mm.
going to certain restaurants. So the coaches actually ask them, which restaurant are you going to? Okay. So
Okay.
then they tell them and they go to Zomato, they'll pick what to eat and they'll tell them, okay, this is what you can have. What do you feel like having? First they ask them. So veg, non-veg, what it is. Then they help them pick the right menu also. Okay,
So
so
do you like consult in terms of those people as well? I think I'm fit, but again, in terms of nutrition and everything, because the goal is to gain muscle, and because there are many people considering the youth as well, they
hmm.
also want to physically improve themselves. Some want to get physically fit
Hmm.
for sports, or probably just build muscles, get lean. So is this also a target audience, or only the ones who are actually obese?
So right now it's weight loss and diabetes management. We have not yet gotten into performance enhancement or those kind of
Yeah.
things. Because again, like a company can get into many things, but again, the focus is key, right? So we need to focus on certain target audiences to, make the best use of the team and what we offer. So that's why we have, yeah, but someday I think that market is also increasing these days. So I think someday we will.
I guess it's almost an hour and we are done. It was really nice talking to you, Reshma.